Let me ask you something. When was the last time you smiled in a photo without thinking twice about it? Not a careful, closed-mouth smile, but a full, open, completely comfortable smile. For a lot of people, that moment starts to feel less natural somewhere along the way. Not because anything dramatic happened, but because teeth gradually change over the years. They pick up color from coffee, from tea, from red wine, from simply living a full life. And at some point, you look in the mirror and think, when did that happen? Here's what I want to tell you today. You do not need an expensive dental procedure to do something about it. You do not need to order strips online or sit in a dentist's chair under a bright light. What I'm going to share with you today costs around $3, uses 2 ingredients you can find at any grocery store, and works gently and safely over a few weeks. I am also going to talk about something called oil pulling, an ancient practice that has been getting a lot of attention lately, and for good reason. And then I want to share something that most people have never connected before, the relationship between sugar, vitamin C, and the health of your gums. That last part surprised me when I first learned about it, and I think it will surprise you too. Let us start with the 2 ingredients. The first ingredient is baking soda. You almost certainly have this in your kitchen already. A box of baking soda costs around $1.79 at most stores, and 1 box will last you a very long time for this purpose. What baking soda does is provide a very gentle texture, just enough to help lift surface stains and plaque from the enamel of your teeth. I want to emphasize the word gentle here, because this is not an abrasive scrub. Used correctly, baking soda is one of the mildest and safest things you can apply to your teeth. It has been studied extensively and is considered safe for regular use at home. The second ingredient is hydrogen peroxide. Now, before anything else, I want to be very clear about something. Not all hydrogen peroxide is the same, and this distinction genuinely matters. What you want is the standard bottle you find in the first aid section of any pharmacy or grocery store. It should say 3% on the label, or it may say 3% or less. That is the one you want. Please do not use a stronger concentration. You do not need it, and it can cause real discomfort and sensitivity if used at higher levels. A small bottle of 3% hydrogen peroxide costs around $1.60. For what we are using it for, that bottle will last you months. Now, why does hydrogen peroxide work on teeth? Here is the simple version. The stains on your teeth are made up of chains of molecules that absorb color and hold it against the surface of the enamel. Hydrogen peroxide releases oxygen when it comes into contact with those molecules, and that oxygen breaks the bonds in those chains apart, releasing the pigment. The stain does not go deeper, it simply loosens and lifts. That is the mechanism, and it is the same reason hydrogen peroxide is the active ingredient in the whitening strips sold at stores for $20 or $30, and the same reason dental offices use it in their professional whitening procedures, just at far higher and far more aggressive concentrations. The difference is this: at 3%, the process is gradual and gentle. At the concentrations used in some professional procedures, the results come faster, but there is a real trade-off. Very high concentrations of hydrogen peroxide, especially when combined with strong light sources, can dehydrate the enamel and irritate the gum tissue. Some people experience significant sensitivity afterward. What we are doing at home is slower, but it is also kinder to your teeth and your gums, and it will get you there. Here is exactly how to make the mixture and use it. Take a small container. A little dish or cup works perfectly. Add 1 teaspoon of baking soda. Then add 3 drops of 3% hydrogen peroxide. Then add 8 drops of plain water. Mix everything together until it forms a smooth, slightly thick paste. Take your toothbrush and apply the paste gently to your teeth. Brush in slow, careful strokes, covering the outer surfaces, the inner surfaces, and along the gum line. You are not trying to scrub hard, you are simply allowing the paste to do its work as you guide it across the teeth. Continue for 1 to 2 minutes. When you are finished, rinse your mouth thoroughly with water. Make sure to rinse well. I recommend doing this 2 to 3 times per week, not every day. Giving your enamel time to rest between sessions is part of doing this safely. After a few weeks of consistent practice, most people notice a real difference. The change is gradual, which is exactly what you want. Gradual change with this method means the enamel and gums are being respected throughout the process. One more thing. If at any point you notice unusual sensitivity, simply reduce the frequency. Once a week is still effective. The goal is always to move at a pace that feels comfortable for your body. Now let us talk about oil pulling. You may have come across this practice online or heard someone mention it. It sounds a little unusual at first, but it has a long history and some genuine science behind it. Oil pulling is an ancient practice that originated thousands of years ago. The original technique used sesame seed oil, which is still considered effective. But most people today use coconut oil because it has a milder, more pleasant taste and is easy to find. Here's how it works. You take about a tablespoon of coconut oil, place it in your mouth, and gently swish it around for 10 to 20 minutes. You are not gargling. You are simply moving the oil slowly through your teeth, between your teeth, and around your gums. Then you spit it out, rinse with water, and go on with your morning. The reason this works comes down to what coconut oil contains. Coconut oil is exceptionally high in something called lauric acid. Lauric acid has well-documented antimicrobial properties, meaning it is effective against bacteria, fungus, and certain other organisms. In the mouth, where bacteria are constantly present, this matters. A study published in the Indian Journal of Dental Research found that oil pulling with coconut oil was as effective as prescription mouthwash in reducing the bacterial levels associated with gingivitis. That is a meaningful finding. Prescription mouthwash is specifically designed for that purpose, and coconut oil performed comparably in that research. The bacteria in the mouth are naturally attracted to the oil as it moves around. Over the course of those 10 to 20 minutes, the oil picks up bacteria and other debris, and when you spit it out, those organisms go with it. Most people who practice oil pulling do it 3 times a week, in the morning before eating or drinking anything. Some people do it daily. You can find the rhythm that works for you. The main thing is to be patient. Like the whitening mixture, this is a gradual practice. The benefits build over time with consistency. A small note. Always spit the oil into a trash bin rather than a sink. Over time, oil can build up in pipes. Now I want to share something that I find genuinely fascinating and that I think is worth understanding, especially as we get older. Most people know that sugar is not good for teeth, but the reason is more interesting than most people realize, and it connects to something much larger than just cavities. Here is what I want you to know. Glucose, which is the form of sugar your body uses for energy, has a chemical structure that is very similar to vitamin C. In fact, the two compete with each other inside the body. When glucose levels are high, the body has a harder time absorbing and using vitamin C, even when you are consuming it regularly. Sugar essentially blocks vitamin C from doing its job. Now, why does that matter for your mouth? Because vitamin C plays a central role in producing collagen. And collagen is what keeps the tissue of your gums firm, tight, and healthy. When vitamin C is being blocked or depleted, the gum tissue gradually becomes less stable. The cells that are meant to be packed tightly together begin to loosen. Small gaps form. You may have noticed this at some point without connecting the cause. You floss your teeth and there is a little bleeding, or your gums feel tender in a way they did not used to. These can be early signals that the gum tissue is not as strong as it should be. Here is why this matters beyond just the appearance of your gums. When the tissue of the gums becomes permeable in this way, it creates an opening for bacteria from the mouth to enter the bloodstream. This is not a minor thing. Researchers have found dental bacteria in the arterial plaque associated with cardiovascular concerns, and in tissue samples studied in connection with cognitive health. The mouth is not separate from the rest of the body. What happens in the gum tissue can have effects that reach far beyond it. The practical takeaway is straightforward. Reducing the amount of sugar you consume regularly is one of the most meaningful things you can do for your gum health, and by extension, for your overall health. And making sure you are getting adequate vitamin C, whether from foods like citrus, bell peppers, and leafy greens, or from a supplement, helps keep the gum tissue firm and healthy. These are small adjustments, but over months and years, they add up to something significant. Let me bring everything together before we finish. Your teeth can look noticeably brighter, and your mouth can feel healthier without expensive procedures and without anything harsh or complicated. The mixture of baking soda and 3% hydrogen peroxide, used 2 to 3 times per week, works gradually and gently to lift surface stains. Oil pulling with coconut oil, done a few times a week, supports a healthier bacterial environment in the mouth. And reducing sugar, while making sure vitamin C is part of your regular routine, helps protect the gum tissue that holds everything in place. None of this requires a big investment. None of it requires a specialist. It requires a little consistency and a little patience, and the results will come. I would genuinely love to hear from you in the comments. Tell me which of these you are going to try first. And if you have already tried oil pulling or the baking soda mixture before, share your experience. This community learns from each other, and your comment might be exactly what someone else needs to read today. If this video was helpful to you, please consider sharing it with someone you care about. Sometimes a simple piece of information passed along at the right moment makes a real difference. Thank you for being here today. Take good care of yourself, and I will see you in the next video.